I'm Amanda Whittal.
And I'm Eszti Bakos, and we are research coordinators for the Foundation for Alternative and Integrative Medicine.
FAIM's goal is to share information about health options with the public through the expertise of over 100 guest writer medical practitioners, as well as international projects to learn and share options for health that are available worldwide. All information can be found on our website at www.faim.org. As part of this work, we regularly interview practitioners from clinics and health centers that we feel the world should know about. We hope you enjoy today's interview.
We're here with Dr. Rogier Hoenders, an integrative psychiatrist and head of research and clinical affairs of the Center for Integrative Psychiatry in Groningen in the Netherlands. Dr. Hoenders' work and passions extend across research, education, and healthcare. He initiated and directs the Lentis lifestyle program, where patients and staff are trained in mind-body medicine and a healthy lifestyle, including spirituality. And he's the founding president of the Dutch Consortium for Integrative Medicine and Health. As a global expert, Dr. Hoenders works with the World Health Organization and the presidents of other national consortia for integrative medicine on developing policies regarding integrative medicine and approaches.
Dr. Hoenders, thank you very much for taking the time to speak with FAIM today. You're a psychiatrist by training, with experience ranging from individual practice to research, leadership, and advising on integrative medicine policy. Could you start by telling us how you got involved in integrative medicine and why you feel it is so important?
Yes, I'm happy to do so. And before I do that, I'd like to thank you for the kind invitation to share some of the work my colleagues and I have been doing, because this is really a group effort. And I'm representing a lot of people here, so I will explain about that later. And but I'm happy to contribute to this initiative of FAME and spreading information about integrative medicine in different parts of the world. So that's great. Um, I got into this field, I think it was like a combination of different factors, but important to explain is both my parents were involved in conventional medicine and traditional medicine. So my father was a family medicine doctor, and he got into homeopathy and acupuncture. And my mother was a nurse at the academic hospital, and then she moved to naturopathy and massage. So I was kind of used to an integrative approach for health. And I was very naive and young when I entered medical school, and it was kind of a cold shower to learn that I was not supposed to be enthusiastic about some kind of modalities. So I learned it the hard way, and I decided to keep it silent, my interest in other medicines, while going to medical school, and after that specializing as a psychiatrist. But when you finish your psychiatric training in the Netherlands, you have to present a scientific talk to like about 150 people of the academic centers, like professors and heads of the department, and you have to, it's a kind of a difficult task to do. But it has to be something you are like full about, very interested and enthusiastic. So I asked the director of the residency program if I could do it on complementary medicines. And so I think he had a difficult moment after that, and he had to breathe in and out. And then he said, "Okay." After we talked for a while, he said, "It's on one condition, and the condition is that you're not going to speak about your personal point of view, but just give an overview of what is known about these modalities and the science base, or where it's lacking or not." And that was actually quite good advice, because by doing so, I managed to survive in this biomedical academic environment while addressing this topic. And it started with a very small interview of patients and also a psychiatrist about the subject. And then I wrote an article about it. And then years later, it moved to my PhD on the subject, and now more recently also on a research chair in the department.
It's quite a journey, honestly, and thank you for sharing it because I think everyone gets into the field in different ways,
Yeah.
and to be able to essentially integrate it into the end of your studies like that and build on it is quite impressive and shows that it can be done. Although the worlds are still in a lot of ways quite far apart, it is possible.
Well, yeah, I would say
So,
they are really far apart because this is like a very short summary, but in between there were a lot of much challenges and difficulties. So, for instance, we have quite some skeptics and critics on this field in Holland. It's quite strong, even more than in other countries.
Mhm.
And so when I was finishing my PhD, there were actually people trying to block it, and they even harassed the university and tried to move them to not give me the certificate because of the subject. Even though I said to them, well, listen, it's not about the subject, it's the way how you approach the subject, whether something is scientific or not. So let's have a debate. Please come. I will do my defense and you can put in your arguments. But they refused to come and still try to block it. And we had quite a lot of these attacks around through the years. But
wow.
but I learned, and this is also why I think it's important to include spirituality in this part. I learned that it is important to train yourself to deal with these difficulties and try to avoid being dragged into a fight. And so when I was challenged in this way quite early in my career, it was really difficult to deal with it. I asked my meditation master how to deal with it. And then he looked at me and he said, "They are angry. Don't join them."
Wise
And
woman.
that was good advice because it learned me not to respond in the same way that they were treating us. And just keep your balance, keep your peace, and respond on the content based and not on the personal part. And so, as a sidetrack, I've been really involved in spirituality and meditation and different practices alongside this career development, and it was really helpful because otherwise, I think I would have gone off track somewhere.
It does sound really challenging, and healthcare costs continue to rise, and scientific evidence indicates that lifestyle is a major predictor of modern chronic diseases. Focusing on the patient as a whole should not seem so unreasonable.
Right. And I think lifestyle changes are now more or less accepted. And most critics and conventional doctors, on average, they don't have so much problem with it because it doesn't challenge their assumptions. It doesn't challenge their ontological, pre-scientific viewpoints of how life can be or what kind of things can be valid or not valid or even be existent. Uh, and I think this is the main point because when our fundamental beliefs are being challenged, then a strong response can be as a result. And this, I think, is usually the reason why the debates are so heated and so strong. And so lifestyle changes are now a little bit in the middle. Then when we have herbs or natural medicines, which you mentioned before, this is also more or less okay, even though some people are more interested than others. When you go to like more energy medicine or spiritual approaches, then there's a lot more opposition. And part of it, I think, is even reasonable because it's important that we understand how things work and how we need to have some kind of evidence base. But I also noticed that it's not an equal fight. It's like that if something is resonating with the viewpoint of the critics, then they accept it very easily. And if it doesn't resonate, even though there's good evidence and mechanistic studies, then they don't accept. So it's how we are as humans, I think.
Is probably part of the human condition.
Yeah.
But I think it's very, I guess my comment about the worlds being still somewhat far apart is a bit optimistic. It's is something that is absolutely worth working towards. And I'd like to definitely come back to this kind of debate later on, because we're quite curious about the policies, the regulations, kind of the state of our system's readiness to accept, especially things on the end of the spectrum towards energy medicine. So we're extremely interested in that. Just before we get to that, I'd be really curious to explore a little bit about your own experiences, because I think that for our audience, it would also kind of ground them in what we're talking about and where these kind of higher level integration points come in. So yourself, a big part of your experience with integrative medicine is working as an integrative psychiatrist. And this is something, I guess, the people level of what you do besides the research and the policy work. And I wonder if you could just explain to us a little bit what is meant by integrative psychology. Is this something that's, maybe you could also touch on, is it accepted? Is it one of the things that's more in the middle of the spectrum or more towards the challenging end in terms of critics accepting it? What does it entail?
Okay, so integrative psychiatry, from our point of view, is integrative medicine being implemented in mental health care. So we define it on the same four principles as the American Consortium has been defining it. So it's about optimizing the therapeutic relationship, an holistic approach, not only putting away symptoms, but also increasing resilience and health, and making use of all appropriate therapies and therapeutic approaches. This is like the summary. And to explain to my colleagues, I try to make it even more simple. So we usually explain, we work on in 4 steps. And the first step is a very broad general psychiatric assessment, which is like, it's more or less normal psychiatry, but in a broadest sense. So it also includes taking care of the physical body and looking after people with their diet and their weight and all of these kind of things, and also the social part of psychiatry and income and shelter and housing and everything. Then the second part is lifestyle interventions, which we divide in small and big. So the small is a combined lifestyle intervention with the essence of nutrition, exercise, relaxation, sleep, intoxications like drugs and alcohol, social relationships, and spirituality. And this is all integrated in like a more easy to follow program for people who are more on the low level of functioning. And then there's the more bigger interventions like mindfulness, meditation, or yoga, or acceptance and commitment therapy, or these kind of interventions when they are able to follow this. So that's the second step. And the third step is prescribing natural medicines, where we advise about herbs, supplements, vitamins, probiotics, psychedelics, all of these kind of substances, which for some people are more acceptable than Western chemical drugs. You can have different ideas about it, but for some people it's important to have something which is natural. We always explain it, if it's natural doesn't mean it cannot be harmful. But this is important. And the most toxic substances are in nature, so we have to be a little bit careful. But on average, most preparations, if you have a high quality, then it's usually it has less side effects. And for people with chronic symptoms, which are not extremely severe or dangerous, then it can be an interesting supplement, or even sometimes replacing psychopharmac. And then the fourth step is advising patients about any other modalities which we cannot do inside our own center due to the Dutch law, due to the reinsurance rules, due to many things. But then we advise people, if you're going to use whatsoever acupuncturist or homeopath, do it in this way. We give them about 10 like advices to prevent them from harm. For instance, go to a therapist which is a member of a nationwide union, and they are not against psychopharmac from the psychiatrist, and these kind of things. And so this is in a nutshell how we approach it. And that means that inside our center, it's not so different from other centers in Holland, but the extra thing is we have more on lifestyle. We have a big center of mindfulness meditation and yoga, and we have the natural substances. This is what's different. And then the advice and being able to talk about complementary medicines an open way, transparent without judging or negative advices. This is also something different. And this is in a nutshell what we do.
It's quite amazing. And it's not an inpatient, is it an inpatient center? So they stay or they can be outpatients as well?
No, it's only outpatient.
Okay.
We are part of a large mental healthcare organization called Lentis, and Lentis has about 3,500 employees and divided over 60 locations in the north of the country. And we are a small outpatient clinic of about 40 employees, serving about 500 outpatients. But we have the most severe cases. So we are more or less a last resort clinic for people who have on average about 10 to 12 years of history in psychiatry before they come to us. And most of them have had everything which psychiatry has to offer, which means that from a viewpoint of like guidelines and protocols, everything has been done already. So that gives us some space to explore other modalities. But it also means that we have people with quite severe symptoms. And we focus mainly on mood and anxiety and trauma-related disorders with comorbidity on personality disorders and medically unexplained physical symptoms. This is like the group of things we see mostly.
Okay. I know, I think Eszti has some questions about that Lentis program. And just before we get there, I have one additional question, just because you brought up this notion of where you are in the patient's treatment timeline, which is at the end usually, or quite advanced. And we had been thinking about the additional patient benefits that come out of having an integrative approach as opposed to a strictly conventional approach. And I wonder if you could explain your thoughts on, in these cases, I'm sure it's great that the patients eventually get to you. Would it be better for them if they were coming to you earlier? Or do you think it's necessary to go through those steps of having tried all options that they're more familiar with and then coming at the end? Just because in a lot of natural health practices, I get the feedback that it would be good if we were a bit earlier with them. And I wonder how it is in your case.
Yeah, I understand your question. I get this question a lot. It was a strategic choice to do it like this.
Okay.
Because when we started almost 20 years ago, there was no room whatsoever in Holland to do these kind of things. So we had to open a door. And that means that we had to start from a very, very small step. And so the most easy step for me was to position our clinic after all the other treatments. So we could have no difficulties with people arguing that we were harming them and we are not following protocols. So we didn't want to violate protocols, but we wanted to have a lot of room. And the second reason was that I know so many people who are working outside of mainstream medicine, but this is only for the elite. And I wanted to do something for patients who depend on the healthcare system, which have nothing else in their lives. So we wanted to do that for them and then have more space. So this leads to this approach. We also made the CAM protocol, complementary and alternative medicine protocol, where we have written down the whole way how we work. People can find this on the internet quite easily, I think. And also, if people want to have more information about our center, they can also go to either to LinkedIn or ResearchGate, because many of our papers are available online. But this was the reason. Still, I believe that this approach can be implemented all through the whole array of healthcare. And the best would be, of course, to prevent sickness to come about in the first place. But this is a difficult subject because then you looking at prevention, but prevention, I don't know how it's in other countries, but for us, there's no money for prevention because nobody can make money off it.
Yeah.
So nobody's interested. And so we have to wait till sickness comes about and then try to fix it. But I would love to have the first intervention there. And then also the first line, I would rather have treatment options for people with mild symptoms, first based on self-care, on mind-body medicine, on natural medicines, before giving them our medications, because medications can be effective, but they also usually have side effects and dependency issues and other difficulties. So yes, I would definitely go there, but we started here because of reasons.
Makes sense.
And speaking of Lentis, you started and still direct the Lentis lifestyle program, which involves training patients and staff in mind-body medicine and healthy lifestyle, including spirituality. Can you tell us a bit more about what this program looks like and what it aims to achieve?
Okay. So it started in this way that I started with one secretary 20 years ago, and our center grew to like 40 employees now. And over the years, it was clear that our lifestyle programs, which we developed in this small center, would be useful for the whole organization. So the board of directors, the highest part of the institute, asked me to expand our program not only for our own center but for the whole organization. And that was the starting point of the Lentis lifestyle program. So then I wondered, how can I be of much benefit for such a large organization when we only have a few people? So the only answer was to transmit knowledge and experience to others so other people could start themselves in their own environment. Also because we are treating our patients, adults, with mainly mood and anxiety disorders. And there were also people working inpatient with people with psychosis or bipolars or juveniles or even delinquents. We had many different departments. So we thought we give them the basics and then they can adapt it according to their own environment and their own main targets, how to approach that. And then we also realized that a very important part of lifestyle medicine is practice what you preach. So we wanted to include from the very first start as like a condition for people who wanted to enter that they also work on their own lifestyle. So the training program it's implemented inside the program, so people get information from us, but they also do the intervention themselves. They learn how it the effects of it, and then they go implementing it in their own part of the organization. And also, I think what was helpful in this is I'm also a Western psychiatrist, so my colleagues. I think they were a little bit resistant at the start, but they also see me doing the same work. I'm also there at the emergency department at night shifts and doing the same kind of work. I don't have anything against psychiatry as a whole. I like this work, but I also see ways how to improve it. And being there, working there, I work now there for 27 years. So I know people, I have my colleagues, that makes it more easy to implement. And I think finally another reason why it was successful is that I could help in different ways because I'm a psychiatrist from training. But then when I started the clinic, I also became the managing director. So I learned about management and how to implement things. Then I started my research. So I also looked from the scientific part. And meanwhile, while we were at it, we got involved into the residency program of psychiatry. So I was the deputy director of the residency program. So we started also putting integrative psychiatry and lifestyle medicine inside the residency program so that the new psychiatrists who were being trained in our area, they all knew about these ideas. And now we can see after many years later that the whole pool of psychiatrists in the north of our country, they are more open to it because they have some experience during their training.
it sounds like the program really integrates mental, physical, and even different aspects of health. You already mentioned a few modalities that you work with, but what should the patient expect? Can you give some examples that it includes?
What people can expect when they come to our center?
Yeah, with the Lentis lifestyle program.
Okay, yeah. So the lifestyle program is for the whole organization, and it really depends where people are being admitted, the way in which it is being brought to them. In most clinics of Lentis, this is like an option um, on the side next to the main program of the psychiatric treatments, which you can find anywhere. In our own center, it is a little bit more strongly integrated. So it means that people, it's not like a question if you like to participate, it's more like when are you going to participate? And that makes a difference. Also, the people who work in our center, most of them have quite extensive experience either with mindfulness meditation or running therapy or yoga. So they also speak from their own experience, which made it a little bit more strong. And then another point is that I noticed over the years that when people come or they're being admitted to the psychiatric clinics, usually these people are in despair because they have tried whatever they could and they feel they are sad or depressed or anxious or whatever. So the first part of the admission and the first weeks is usually not the best moment to start with lifestyle. It's better to build the therapeutic relationship and give them some hope and try to diminish some of the symptoms so they can get a little bit more feeling of resilience and of hope and of energy. And then after a few months, we say, well, by the way, you can also do something by yourself. You're not only dependent on me, there's also more things we can do. So we usually introduce lifestyle after a few months. There are some exceptions, but speaking on average, I think it works better in that part of the treatment.
That makes sense.
Also quite an interesting example of on the scale of where you're working and practicing, a really kind of successful integration into a broader system or institute of some of these more integrative practices, which I think is quite inspiring because it doesn't always work quite that way. And it kind of comes back then to what you touched on a couple of times previously, which is there are critics of different complementary and integrative approaches, and you are working on the policy side as well. So from your experience and also your research, but also your work as managing director in this area, what do you think having more kind of solid policies around complementary and integrative medicine can do? Why is it important? Why has it been so slow for alternative, integrative, complementary medicine, pick the term that you will, to integrate into wider policies? So I think your institute is a great example. We'd love to see it at a wider scale in all kinds of areas. So if you could speak to that a little bit too.
Yes. We wrote a paper last year reviewing the WHO strategy. I think we touched on some of these points in the paper. So there are many different aspects to it. One of them is we spoke before about the viewpoints of people, and they call it from science, they call it ontological viewpoints, like how you view the world and what you think is possible or not. So this is one major obstacle, especially for homeopathy and energy medicines, because I see that the most strong opposition is to that. So holding on to your own viewpoint is this is impossible, it could never work, so I would not be convinced. I remember one professor of epidemiology, like a very distinguished scientist. He spent like many decades on scientific research published in high journals. And then he was so irritated about a discussion on homeopathy And so he said, okay, once and for all, I'm going to solve this. So I'm going to do a meta analysis, summarizing everything. So I will show to you that it's all worthless. And then he said, I had a problem because either what I've been doing all my life, my whole career, the way of synthesizing scientific evidence is not valid, which I'm not willing to accept because has been my whole career, or the outcome is true, which I'm also not willing to accept because it cannot be that all these homeopathic studies have an effect above placebo level. So then he said, in the middle of this interview, he got a little bit more anxious, and he said, I'm not willing to accept it even if it was true. And I thought, wow, that's a great statement because that's exactly, he was honest, or it slipped out. But anyway, it really shows the heart of the problem. And that means that you rather hold on to your own viewpoint than letting go, even though you are faced with something which you believe in as the scientific method. So I think this is the number one problem of the slow progress of the field. Then there are several others. For instance, the amount of money which is available for scientific research on complementary medicines is like less than 1% of all the money there is. So you can never get to the same level of evidence if you have no funds, right? I think Edzard Ernst once calculated it was 0.05%, something like that. Anyway, it's almost nothing. Then there's another problem, and that is that not all people working in complementary medicines are open to scientific evaluation. Some people are resistant. Or another problem, we don't have very talented scientists who are interested in doing research on this subject. Sometimes because they are not interested at all, or they are afraid it will harm their scientific career if they go into the subject. So then you have the problem that in most countries, complementary medicines are not reimbursed for people with low income. There are examples, exceptions, like in Swiss and in Germany, there are some things being reimbursed, but on average, it's not so much the case. So then it's difficult for people to get access to it, and then it also hinders the development. Then there is the problem of the contamination of natural supplements, sometimes with medicines or with steroids or with heavy metals or these kind of things. So you need also better quality. Then there's the influence of the pharmaceutical industry and other industries who have an interest in keeping things as they are. Well, to name a few. So people often ask me what should be done. I think everything should change, but we all have to work where is our own circle of influence. So what we try to do is to do some research on some modalities and to work on education, as I just showed that now that we put it into the residency program, we now in the last 10 years, we have trained about 30 or 40 young psychiatrists. And that means something because these 40 psychiatrists will be working for 30 or 40 years and they will influence the new generation. So I think we have to look at education for that effect. We have to go into science to prove whatever is working. And then we have to improve the quality to diminish the difficulties, which are also giving you a setback. Because I remember sometimes there is like a report of a side effect of a natural medicine, and it's like the media explode. It's like an atomic bomb have been dropped, and then it's so over exaggerated that it's really not in balance with the side effects we usually have every day from other medicines. So you don't want to give them arguments to block it. And Then we have to work also on information on the consumer level because most people don't know where to turn for reliable information. If you go now on the internet, you have like it's like a war zone of information. So we need solid databases with information which is also brought in a way that people can understand and be more informed consumers. So everywhere. And I usually say, try to pick whatever is most close to your field of influence and try to add something. And then if all of us adding something, that will have a ripple effect and somewhere it will turn over.
Absolutely. I think you very nicely answered our question because we were quite curious about what you see as next steps and what different practitioners and people can do. And I think you just wrapped it up in a really nice way for people to understand. And indeed, big change requires small steps from everyone. So I think it's inspiring words to go forward. And I know that our half an hour is going by extremely quickly, but before we kind of thank you and say goodbye, is there anything else just in general about your work, your practice, your research, your policy that you want to share that would be helpful for patients or practitioners that are going to hear this interview?
I touched a little bit on it at the beginning of our talk, and I think that I can put a few more words about the aspect of the need of to have a spiritual practice, because I think it can be very helpful. And it can be religious for some people, and it's my own interest is mainly in Tibetan Buddhism, because I got into contact with people from Tibetan Buddhism, and I really very interested at how they explain how the mind works. So I learned the mind from a Western psychiatric perspective and also from brain research, but this adds another layer of an understanding the mind. But even more, I think when you go into this field, basically wherever you go in the world, we are challenged by war, by climate change, by so many difficulties. And before you know it, you are fighting either with yourself or others over the world in at large. So having a practice or a support to keep your inner peace and to maintain your balance, even though you are challenged or have people try to fight with you. That I think is very useful. So when you go into integrative medicine or complementary medicine, whatever, you need also to be a peacemaker and to avoid getting into polarized debates, but to try always to deal with the negativities. And that, on top of all the things we just explained, might also be very helpful in going taking this a step further. So I would like to close up with two quotes from I had two meditation masters. One is an old meditation master. He passed away during COVID 5 years ago, and he said, "Inner peace is the most solid foundation for world peace." And for me, that's very inspiring because also in the aspect of religion or spirituality, people sometimes tend to fight, and then they are fighting for peace, which is a contradictory in itself, I think. So we need to work on our inner balance and inner peace. And the new generation teacher who took over, one of his main quotes is, "Have a high aspiration, low expectation, and constant effort, because effort without perseverance is a waste of energy." And that also goes for integrative medicine.
I'm going to take those two quotes. Dr.
Well,
Hoenders.
before,
I'm sorry, Eszti.
just one thing before we wrap up, from me at least, for the audience, if patients or practitioners wanted to learn more about yourself, your work, integrative psychiatry, or anything else that you mentioned here, how can they best inform themselves or get in touch?
I think the best way for people, if they want to learn more, is to go to ResearchGate. I don't know if it's so familiar for most people, but researchers usually know. And so all our publications are there. And if it's not openly available, if the publisher didn't allow that, then you can also send me a message through this a ResearchGate, and then I can send a private chapter or paper to people who are interested. And if people want to know more about our work, when there's any updates, I usually put them on LinkedIn, because this is my main source of spreading information. So if people are interested, they can follow that. And then I've been sometimes approached by people for consultation from around the world, but it's kind of difficult because only working online, it's a little bit challenging, and usually it involves medication which can have effects which you need to be following up. So I'm not so fond of online consultations, but sometimes I can give one-time advice on go there or go to this person, or I have some contacts there. So that is sometimes possible. And in that way, people can either send me through LinkedIn or send me a message through email online. I think
Thank you.
they can find the emails on the bottom of the scientific papers. It's always there, corresponding author, and then you can find it.
That's useful. Thank you.
Thank you so much. And we will share the ResearchGate links for people to click on easily. And I think from our side, just thank you so much for everything that you and your team are doing and for sharing the information. It would be very useful for people to know more about this and to think about how they can contribute to change for the better in the world. So thank you so much.
I'm very
Thank you.
happy to hear.